I basically have been a patient with Dr. Huey for almost 7 years. I think it'll be this upcoming summer. I basically self-referred to him. I actually worked here in the health system for many, many years. And I have multiple autoimmune disorders. I was on a biologic for a number of years. And while I was on it, unfortunately, I developed cancer. And I had cancer surgery, and obviously I wasn't going to go back on a biologic medication. So I started looking for alternative therapies for myself so that I wouldn't have to do my injections, and that, my goal was to be off of steroid and anything else that might, lead to a pathway for recurrence of my cancer. And that led me to Dr. Huey, and I started there. I had basically my first induction appointment was fantastic. It's a teaching institution. So I had a great fellow who was learning at that time, joined Dr. Huey, did an assessment for me on my diet, talked to me about the different contributing factors in my life that I could, work on to mitigate some of the stress and some of the other things that would basically help me overall reduce the inflammatory responses that I kept having, so that I'd be able to maintain my ability to work and walk and everything else without the use of pharmacologic intervention. So we started doing that, and I went from going, I think, and having acupuncture multiple times a week to now I still do maintenance all this time later. I'm usually there like every 2 weeks or every 4 weeks. And it's fantastic. I have only been on steroid in 7 years, one additional time for a very brief period. I take NSAIDs very infrequently. I do water therapy. I have done Tai Chi, and I exercise with my girlfriends 5 times a week, and I work. And now I'm retired, so my stress from work is absolutely reduced. But I would say that I feel the same now as I did when everything kind of locked in about 12 months ago. So I'm very appreciative for the opportunity to be seen by him. Thanks.